Good morning, everyone. I, Kirtika, and my teammate Padmapriya are presenting on the topic Medicine During a Woman's Life, a Double-Edged Sword. A woman, through the different phases of her life, is exposed to various investigations and treatment modalities. These advancements of medicine act as a double-edged sword, impacting her life as a whole. The idea that small things can have unknown, huge impacts on a complex system is what we call the butterfly effect. So now, let's travel along with her through the different phases of her life to see how the smallest to the biggest advancements in medicine have impacted a woman's life. First comes the phase of her infancy. An infant when born will be vaccinated as per the national immunization schedule. The oral polio vaccine, which is used to prevent poliomyelitis, can lead to vaccine-derived poliovirus and vaccine-associated paralytic polio. Many such vaccines have the threat of producing hypersensitivity reactions in a hypersensitive infant. After the phase of her infancy comes her childhood. Rheumatic fever, which is commonly found in females in the age group of 5 to 15 years, is characterized by joint pain, sore throat, fever, and fatigability. The most common causative organism is the group A beta hemolytic streptococci. A diagnostic criteria used for rheumatic fever is the Duckett-Jones diagnostic criteria, where the major criteria consists of carditis, migratory polyarthritis, subcutaneous nodules, erythema marginatum, and Sydenham's chorea. The minor criteria consists of fever, raised ESR or C-reactive protein, arthralgia, prolonged PR interval, and a previous case of rheumatic fever. Rheumatic fever is more prone to cause heart diseases such as mitral stenosis and mitral regurgitation, which later might progress to congestive cardiac failure. So, the penicillin group of drugs are given for treating such a condition. Now let's say the patient is allergic to penicillin but is injected penicillin by mistake without doing the test dose. Then anaphylaxis can occur, and this becomes very detrimental if not treated immediately. After the phase of childhood comes adolescence, where menstrual disturbances are quite common. Oral contraceptive pills are usually given to treat dysmenorrhea, premenstrual tension, Mittelschmerz syndrome, and menorrhagia by preventing ovulation. They also help in preventing ovarian and uterine cancer, fibroid uterus, colorectal cancer, acne formation, and hirsutism. But unfortunately, they have the risk of promoting thromboembolic events. They may cause breast cancer and are also highly contraindicated in severe hypercholesterolemia. After adolescence comes a reproductive period. Polycystic ovarian syndrome is quite a common endocrine disorder affecting 4 to 12% of the reproductive age females, and it causes infertility. Clomiphene citrate is one drug that is used for inducing ovulation. Now let's consider the case that a female is not diagnosed as PCOS but is still given clomiphene citrate. Here, the very drug which was used to treat infertility might turn as a sword against her and aggravate the cause of her infertility, which is PCOS. Another example would include the above images showing pelvic inflammatory disease and a hysterosalpingogram, which is a diagnostic modality to know the tubal patency and to understand the cause of infertility. But it has its own risk of aggravating acute pelvic inflammatory diseases and is hence contraindicated in pregnancies. Though different types of contraception can be used in spacing and preventing STDs, they have the risks of failures and precipitating diseases such as ectopic pregnancies and pelvic inflammatory disease. Next comes the phase of pregnancy. A pregnant woman diagnosed with breast cancer cannot be given appropriate treatment during pregnancy as compared to the normal individual, since hormonal therapy and radiotherapy, when given during pregnancy, can cause defects in the fetus. Also, due to the risk of irradiation, the mammogram, which was a diagnostic modality for screening for breast cancer, cannot be used during pregnancy. Instead, we can use USG or MRI. A pregnant epileptic patient makes it even more challenging to prevent congenital defects in a developing fetus, since most of the anti-epileptic drugs are contraindicated in pregnancy. Examples would include phenytoin, which can cause fetal Hayden-Toyne syndrome, and valproate, which causes neural tube defects, cardiac, genitourinary malformations, and limb defects. Finally, after the stage of pregnancy and after embracing motherhood, comes the final phase of her life, where she becomes an elderly. Rheumatoid arthritis is quite common in females, 4 to 5 times more than that of men when she is less than 50 years of age, and twice as that of men during the period 60 to 70 years. Steroids are given to treat rheumatoid arthritis, but again, they can cause osteoporosis, cataract, ulcer, hypertension, pancreatitis, and diabetes mellitus, thus making the standard of living very tough for them. Finally, I would like to conclude. A woman for whom medicine is both a boon and bane, traversing the phases of her life, faces many hardships. Hence, we, as her healthcare professionals, should try harder to lessen the burden on her shoulders. Thank you.